Now I'm going to talk to you about our Lucente program. Our Lucente program is not just a pigmentation program. It is a program that allows you to give the client their home care cream in addition to what they're going to use inside the treatment room. So these two vials are what we are going to microneedle, and this cream is what your client is going to use for the month of treatment. Lucente is best done when it's used in a series. You want to do 3 months, 6 months, 9 months. We know that pigmentation takes time to resolve. So we need consistency and an actionable plan, and that's what Lucente gives you. Lucente is our depigmentation program that is specifically made to treat pigmentation and melasma. They're one of the most common problems that we see in our treatment rooms, so it's really important that we have something that we know is going to work, and Lucente is it. The Lucente program comes in this box, and in this box you have the cream for your client's treatment on a daily basis at home, and you have 2 vials of mesotherapy to microneedle into the face. We'll talk about microneedling and what depths we want to use with this, but please know that pigmentation is a long-term plan. We're not going to be able to resolve our client's treatment plan in just 1 month. We want to do it in a series. Minimum 3 months, ideal 6 months, potentially 9 or 12 months, but it is going to work. Let me show you how Lucente works microneedled. One of the most important things that we have to take into account when we are treating pigment with microneedling is the depth that we use. We do not want to go any deeper than 0.25 to maybe 0.5 if necessary. Let me explain why. Our melanocytes live very shallow in the epidermal layer of the skin. If we then microneedle deeper, we get pinpoint bleeding, and we're not going to get any of the product and ingredients that we need to penetrate. In addition, we may be causing unnecessary inflammation in the skin. What we want is stimulation and product penetration with Lucente. We don't want to over-inflame the skin and potentially cause more pigment.
Begin with a thorough cleanse using the BioCleanser to remove impurities, residue, and excess oils. A double cleanse may be required to ensure the skin is completely clean and properly prepared for treatment. A double cleanse may be performed if needed to ensure the skin is completely clean. Next, the skin is wiped first with a dry cotton pad and then with a damp cotton pad. This allows for effective cleansing without excessive foaming or unnecessary steps. Once the skin is clean, it is sanitized using 70% alcohol to prepare the skin before microneedling. With the skin prepared, the microneedling device is turned on and set to a superficial depth of approximately 0.25 millimeters. At this stage, treatment begins using Lucente serum, which is designed to be delivered superficially into the skin. It is important not to work too deeply, remaining within a safe range that affects the melanocyte. During microneedling, the skin is held taut to ensure even infiltration across the entire face. The desired clinical endpoint is mild erythema, with no inflammation or pinpoint bleeding. If pinpoint bleeding occurs, the area has been overtreated and the product will not properly penetrate the epidermis. Once a uniform pink finish is achieved, we move on to the next area. In areas with higher pigmentation, depth should not be increased, as these areas are more vascularized and prone to bleeding. Depth adjustments should only be considered in future sessions if pigment persists in deeper layers. When treating the forehead, depth remains superficial due to limited tissue and closer proximity to bone. After completing microneedling, any remaining Lucente serum may be applied evenly over the face. The open microchannels allow for enhanced absorption of the product. The mild pinkness observed is the ideal clinical endpoint. This treatment may be repeated approximately every 2 weeks, depending on the client's needs.